Remember when you were 18 and you just had to have that belly button ring because it was the cool thing to do? Well, now that you're thinking of getting pregnant, and maybe you should take that belly button ring out, huh?
I don't know. I guess we'll find out. Judy Schuler, co-author of the book Your Pregnancy, joins us now to fill us in on body piercings.
Yes.
So it can really have an effect. Well, obviously it has an effect on your body as you're getting pregnant, especially a belly button ring.
Yeah, most of the time, most women get their ears pierced.
Yes.
And that's, you know, even if you've got ear all around your ear, that's not going to cause any problems during pregnancy. But women get piercings in a lot of different places, and some of them actually can affect pregnancy, or can, like labor and delivery, might cause some problems. Okay. That's why, you know, it's a topic that women need to know about.
Okay, so what are some of the piercings, little PG here, that could actually affect a pregnancy?
Okay, well, let me just tell you where some of the piercings are.
PG.
I will. I'll be very cautious with that. On the face, people do their eyebrows, they do their nose, they do their cheek, their lips, and their tongue.
Yes.
So some of those we'll talk about can be, you know, can cause some problems. Other places on the body that are commonly pierced are the nipples, the belly button, and in the vaginal area. So those three are ones that are more problematic for women. So if you have a nipple ring, when you pierce something, and I'm not sure because I don't have any piercings other than my ears, but in some places in the body it's harder to heal.
Okay.
And I've heard that about the belly button. I've heard young women say it's the hardest thing. It just keeps not healing. But when it does heal, it causes scar tissue.
Yes.
And that what can be a problem if you have a nipple ring, because if you have scar tissue in that area, it may interfere with milk duct, you know, if there's scar tissue in that. So you might have a problem with breastfeeding. Not everyone does,
Right.
but some people do. Then if you have a belly button ring, I would suggest every woman who has a belly button ring who gets pregnant, take it out no later than the end of the first trimester. If it's your first pregnancy, that you don't really start to show until close to about 18 to 20 weeks. So if you don't, as your abdomen grows and, you know, the baby gets bigger, that's going to get stretched. And yes, it can tear, and that can be a problem. Then if you have any piercings in the vaginal area, that can be a problem mainly during labor and delivery.
Yes.
But during pregnancy, the vaginal area gets more blood because your body gets more blood, 50% more usually. So if you've got you know, more blood going to that area, you might have more problems, like with an infection or you know, problems like that. So what we advise is that in your first visit to your doctor, or one of your first visits, you talk about your piercings. Don't worry about the ears. I mean, that's not going to cause any problems. But if you have anything in your mouth, around your mouth, your lips, your I don't even know about the nose, but I know the lips and the tongue. If you have to get general anesthesia for an emergency cesarean delivery, those things can cause your anesthesiologist some concern, because if you swallow something or something in your throat, you know, sometimes there are some problems there. You don't want to have anything that's going to interfere with you getting what you need during labor and delivery. So those are the main things. I would say that your doctor will advise you. He or she has probably seen this many times, and there's probably not much you can ask your doctor or talk about that they haven't already heard. But do follow his or her advice. Now, one thing we do suggest is do not get any piercings during pregnancy other than your ears. Because, you know, there's always a risk of infection. And we don't want to cause any more problems
Right.
than we, than is going to happen anyway. Why add to it? And then, whatever your doctor suggests, follow his or her advice.
Judy, this was a very interesting topic. Really was.
Was it PG?
Yes. It's something that you really don't ever think about
Right.
that can actually have an effect
It
on
can.
you and the baby.
Yeah, there's so many things in your life, as we've talked about the tattoos and how they can be affected by pregnancy. There's a lot of things that women just don't think about, but they do affect you in many different ways.
Well, thank you for sharing with us.
Thank you.
If you want to learn more about your pregnancy, just go online to yourpregnancybook.com.
Calling all actors. Up next, talk to a filmmaker looking for local talent for a new type of zombie movie. That and more right after these messages.